Hello, everyone. I think we're live and very happy to be here again. Another week with Dr. McDougall. And this week, Dr. McDougall is here. Next week, I believe, is Dr. Doug Lyle. Thank you all for joining us. I see everybody here in the chat box coming on. And we have our internet speeds all figured out and everything. So everything should run smoothly today. And we have a full webinar with lots of topics and questions. So as always, I want to thank Dr. McDougall for being here. I was showing him a picture a minute ago, and we're going to show you now. But before that, I just want to give Dr. McDougall a proper welcome and thank you again. Dr. McDougall is a renowned physician and who has written many, many books and has taken care of thousands of patients, and we all love him. So we're very glad to be here. And how are things going in the Santa Rosa, Dr. McDougall?
Well, just fine. Actually, we have an intensive weekend this weekend.
Yes, that's right.
Today is the May 4th. So it'd be probably May 5 tomorrow.
That's right, Cinco de Mayo.
Yeah, there you go. So, yeah. So we're going to have beans probably tomorrow night.
That's right. It should be something Mexican.
We just might do that. You never know. We have a nice turnout. I think we have about 120 people.
Oh, good.
If somebody still wants to go, you can always go to the website and see if there's room. I think there is.
Right.
And so it'll be a lot of fun. You'll be a lot of really nice people, and we'll get a chance to say hello personally, and it'll be good. So come along. And the next thing we're doing would be our June 10-day program, which will be a lot of fun too.
Right.
And
yes,
it's nice to do things by video, but there's nothing like the live experience. That's why
there is nothing like that.
Gaga and other rock stars live, because it's a whole different experience. So it may be just what you need rather than just listen to us on a webinar. You may need to come and say hello to Doug Lyle and Jeff Novick and the whole team. We'd love to see you.
And also, the interaction with other people that are following they're in the same mindset is very powerful.
Very powerful. And hear stories from other people.
Yes.
You'll sit at the dinner table and somebody will tell you, well, I had rheumatoid arthritis and I was basically crippled to a wheelchair, and now I'm doing fine. And somebody else will tell you about their drop in cholesterol, and they got rid of their colitis and their Crohn's disease, and they had bypass surgery or heart surgery, and that was 10 years ago, and now they're completely free of disease as far as they can tell.
Right.
To hear those stories from other people, it's one thing for me to sit here and to tell you that this is what I've seen. And as I've told you, I've taken care of over 10,000 people and 6,000 in a live-in situation. I can tell you my experience, and it may sound like a little bragging, maybe a little forceful. It's not intended to be that way, but those have been my experiences. But to sit next to somebody else who's been a patient just like you, been in need of better health just like you, and have them tell you that it worked for them, and these were some of their trials and tribulations. But it's very simple. As you could do for us. Are you going to show us your picture?
Yes, I found the picture today of about 5 years ago, and I was telling Dr. McDougall it was hard for me to have pictures because I tried to avoid the camera. I was always embarrassed. But being a musician and being in front of people, I couldn't avoid it. And so I found two pictures, and I wanted to show them because I was about 80 pounds, maybe more actually, because by the time I go to you, I had lost a little bit of weight. And so I want to show them so people can see the difference, and that, and you can see that big stomach. I mean, I couldn't keep my shirt in, and I couldn't button, and my face is about to explode. And it was just, I hated looking at the mirror every morning. And besides all the acid reflux and all the other things that come with obesity. And now for about almost 4 years, I've been able to keep the weight off and love the food. And I see, there is one.
Oh my goodness.
That's another one. Yeah.
Yeah.
It's
Well,
just surrounded. And my mother was so worried about me all the time. She thought I was going to drop dead any minute. And I thought so too. I just didn't know what to do until when I was able to go to Santa Rosa, California, and learn what to do and how to do it and when to do it. And I left those at the end of the 10 days just so empowered.
And you've stayed so enthused. You've become part of the
yes.
You've helped so many other people by doing this webinar and working with AJ and going to different conferences and sharing your enthusiasm.
Yeah, I love it.
Your return has been huge.
Huge, yes. And you know what? I got a present yesterday from Chef AJ that I have to show you. I just have to show you.
Okay, well, I get presents from her all the time too.
This one, though, you're going to have to see. I don't know if you know about, there's a store that has the Geek Squad where they come and they fix your computer. So she sent me a shirt that says Squad. But I'm going to take it off and I can show people what it says.
Potato Squad. Yeah.
Mary, John, Gustavo. And I'm just going to stand up so people see that. Yes, I lost the stomach. So there it is.
Well, I want to say something before we go on.
Sure.
Not only, remember that picture that you just showed was 6 years old.
Right.
Not only do you look trimmer, but you look younger, healthier, more attractive. I mean, all the things that people are looking for in terms of their personal appearance. It's not just losing the weight. I mean, you can take cancer chemotherapy and lose weight. You look terrible. Or you could have you could go on the Atkins diet or the the wheat belly or the grain brain diet. And you go into ketosis and become sick from eating that low carb, high protein, high fat diet. You get sick. You look sick. It's not like you don't lose weight. Sure, you can lose weight, but you look like death warmed over. Maybe it's all the dead animals. Maybe we could make that correlation.
There is something dead inside. That's true. Yeah. Yes. And AJ is here watching. And thank you, AJ, for the shirt.
Yeah, I got a couple of shirts from her this week too. Thank you, AJ. But it's not just the weight loss.
No.
It's the healthier appearance. It's, of course, how much better you feel. It's also younger. I mean, if we could put that picture up side by side, here you are 5 years older.
Yes.
And you look 10 years younger.
Well, yeah. Like you said, to me, then the weight is like a side effect, but the real benefit is the health of, getting rid of a lot of those pains and having more energy and looking better and feeling better. Yes, definitely.
Stop food poisoning and cut your food bill by about 60 to 80%.
Right.
So,
right.
And,
hey, Dr. McDougall, Chef AJ was telling me that a few months ago she was doing a Iron Chef at True North, and Mary was the judge.
Yes.
And she made something that was she called it the McDougall Goldhammer sweet potato stack. And I want to show you this because she made this. That's what it looks like. And it's amazing. Anyway, she's
a great chef and she presents well, not only in her meals, but in her own personal appearance.
Yes.
She's a very, very healthy, young, fit person. And it's obvious when you take a look at her. But when people discover this simple truth, and so many people are discovering it by, spending time on the webinars and also going to the website and looking at webinars that lectures I've given. And the last couple lectures we put up were done by Mary called Meal Planning.
Right.
It really changes everybody's life. This is a 1 hour video that you should, if you really want to change your diet, you should watch it many times. There's so much information in there.
There's so much there. Yeah.
And then there's another video Mary did on eating out. And that's an amazing video. But the first thing she starts out telling you is don't eat out. because it's a disaster. It's really hard to do.
It's always discouraging. I had to go out the other day because I had a business meeting, and it's just always a bad experience. No matter what you say, the food comes swimming in oil, and they stick the cheese somewhere, and I don't eat it. I send it back, or I just don't eat it. But
that's one of the things. We were looking for a vegan restaurant in Palo Alto, California, a few days ago, and they had a vegan Chinese restaurant, but it was so greasy. You couldn't.
No, you can't.
Yeah. No. Well, that's why I try and pick ethnic restaurants, rather than a vegan restaurant. And Mary gave this whole lecture on eating out.
Yes, it's just excellent.
About, how to order in a Mexican restaurant and how to order in a Thai restaurant, and even in a Chinese restaurant, how to do it. Indian restaurants, they're pretty hard. I've always found Indian restaurants a real challenge eating out because
Indian and Italian, it's just impossible.
It's really hard to separate the oil from the food. Even to make special effort and get them to make your food that's not swimming in oil. It's really difficult.
Yeah.
One of the things that folks have learned who have been struggling to go towards, quote, a plant-based diet or more vegan or vegetarian diet is that one of the big milestones, one of the big hurdles that they have to get over is the harm of the oil, how toxic these oils are. The fat you eat is the fat you wear. You're going to wear it and be obese, and you're going to wear it on your skin and get greasy skin and greasy hair and acne. And, it's just one of it's almost a bigger step. And for many people, it is a bigger step to learn that you have to get rid of the olive oil, corn oil, safflower oil. And in some cases, you have to limit your intake of natural oils like nuts and seeds and avocados, or you won't lose the weight. But the idea that these vegetable oils are poisons is a revolution to people. But once they get it, they go, oh, my goodness. That was the key. You can go to my website, look at the discussion board. You can see many people say, once I found out about the oil, then everything was easy. And learned that potatoes were ideal food.
Right.
Of course, if you fry them and make French fries, that changes the whole picture. So the big steps that we've been trying to teach you are steps of simplicity. And the new book, The Healthiest Diet on the Planet, has pictures about this. And I've been talking about it for all my work for 40 years. Is the two food poisons you have to give up are animal foods and vegetable oils. And when I say that, many people say, well, that's all I eat. Well, that's where you have to learn the importance of eating starch, like potatoes and sweet potatoes and breads and pastas and beans and peas and lentils and really simple food. And Mary goes over that very well in the meal planning section. So I would do that. And you
did a wonderful webinar. We did it like a year ago about oil. So people that want to know more, there is a webinar dedicated to that topic.
Right. You can always go to the website. Anything you want to learn about, just go to
it's there
and put in like vegetable oil, and they'll give you a whole bunch of articles to read. I've been at this. I've been writing the newsletter since 1986.
Yes.
Yeah. So that's what is that? 31 years? I don't know. It's a long time.
There's lots of newsletters.
That's all, and every month I haven't skipped a newsletter, even during some very difficult times. I haven't skipped a newsletter every month. So there's a tremendous amount of information there, and I've transferred much of that information from newsletters into the 13 books that Mary and I have written.
Mm-hmm. Right.
So you can have it for free on the website. It's a little less well packaged as it is in the books, or you can get some of the books, which are you can buy them in the used bookstore, some of them for 50 cents or 25 cents. It's not a gimmick, folks. It is not a gimmick. It's free, and you can have it. It's all for yours. The change that you saw in Gustavo's picture should be undeniable evidence that this can happen for you. And if you come to any of our events, our adventure vacations or our intensive weekend like we're having in a couple of days, or any of our 10-day programs, you find that it works for everybody that's suffering from food poisoning. It's just like everybody who quits smoking, they get better lung function, less coughing. Everybody that quits drinking heavily, well, even lightly, but heavily, they find out that their life improves dramatically. Alcohol poisoning is horrible.
Yes.
And so is tobacco poisoning, so is food poisoning. So anyway, that's kind of where we've been. I thought maybe I'd start out discussing last month's newsletter, which was April. But what I did in this April 2017 newsletter is I updated and tried to clarify a few points that I made back then 10 years ago. And probably the main thing that I did to clarify in this April 2017 newsletter was what is the best formulation of vitamin B12? Because there are 4 forms out there of vitamin B12. And let's see if I can find the section I want. There's the cyanoform, which is basically cyanide, with cobalamin. The cobalamin refers to cobalt, which is part of the moiety that makes up B12, cobalt. So cobalamin is the basic molecule that is B12. But that's attached to other molecules, such as there's a adenylyl cobalamin, there's a methylcobalamin, and a hydroxycobalamin. And these are easily found in all stores. In India, methylcobalamin is very, very popular. In different parts of the world, different formulas are very popular. Those 3 forms that I mentioned, the adenylyl, the methyl, and the hydroxy, are natural forms of B12 that are found in the body and also made by bacteria. The synthetic form is the cyano, which means there's a cyanide. That used to be a war gas used to kill people, cyanide. And so it's attached to the cobalamin, basic B12 molecule. The cyanide molecule is attached, so you have a cyanocobalamin. Well, some people recommend that. That's probably the most popular form that you find in supplements in the United States, and also as added to food, to fortify foods with B12. It's the cyano form. Well, I haven't recommended that. I didn't recommend that in my November 2007 newsletter or the Starch Solution book where I discussed this, nor do I recommend the cyanoform now. Why? Because many people respond less efficiently to the cyanoform than to the other 3 forms. And, it just doesn't make sense. Why would you take a synthetic product when there are 3 other natural forms of B12 available that are also naturally in your tissues and naturally produced by bacteria? It doesn't make sense. Plus, the cyanide molecule is collected in the body. Consider you're taking these sometimes once a day, these pills. That cyanide goes someplace. And most people don't demonstrate obvious toxicity, but there's concern about long-term toxicity from the cyanide. So I don't recommend the cyanoform. As far as the amounts you take, you need very little. Maybe 1 microgram, which is 1/1000 of a gram a day. I recommend, and I have for the last 40 years, 5 micrograms, just to be on the, quote, extra safe side. But when you go to the store, you will find it difficult to buy B12 supplements that are less than 500 micrograms, which is 100 times more than I recommend, which is 500 times more than you need. So you say, well, what do I do? Well, that's all that's available is the larger tablets, capsules, or liquid doses. And fortunately, the cobalamin, the actual B12, appears to be non-toxic. Now, I reserve my right to change my opinion on whether or not there are some toxicities from taking B12. But right now, and for the last 40 years, I felt that the advantages outweigh the harms. And the advantages are preventing B12 deficiency, which is one of the threats that people who are vegan or vegetarian are given. And it's not totally a totally unrealistic threat. It's not totally without some merit. It has some merit. There are cases of B12 deficiency. There are lots of studies that show biochemical changes reflecting B12 deficiency. But actual B12 deficiency, there have been a few cases reported which may not truly be due to a vegetarian or vegan diet. They may be just due to poor nutrition, general malnutrition. But, I don't want to be a doctor who causes a case of B12 deficiency, even though the risk of actual disease may be less than 1 in a million. Why should I take any risk with you? Anyway, that's what I recommend. And I recommend that you try all 3 of the forms, the adenosine, the methyl, and the hydroxy, and then have your B12 levels checked to see if you respond well to either of the 3 forms, because people respond differently to either of the 3 kinds of supplements. Well, you go to the store and you look for these supplements, you'll find the 3, but they're usually separate. I believe I've seen one product contains a couple of different forms, but I've been looking on the internet for products that contain all 3 forms. A single tablet or a single capsule. And I haven't been successful yet to find one available, but some company would or should make one. And then you take all 3 forms with 1 pill. And that'll pretty much cover everything in all different types of metabolism. And that would mean right now, probably from a practical point of view, is you'd probably have to take a couple of different, and maybe even 3 different types of supplements. But you can alternate them. You can alternate them every 3 days, every 5 days, every week. Alternate which kind of supplement you take to cover all bases. But then there is some reason to check your B12 levels, give you a little confidence, and it's a cheap test. I think we get it for about $13, but there's also a blood draw charge. So it's a very inexpensive test to get. And it'll tell you what your B12 levels are, and that'll give you some reassurance that your body has enough B12. And the body stores B12 very readily. It stores about a 20 to 30 year supply of B12 if everything's working properly. But anyway, that's one thing you want to check, and this month's newsletter discusses that. All right, so let's not disappoint people, because we did promise we'd talk about some more bowel issues. Now we're talking about the book Digestive Tune-Up that I wrote, again, same time I wrote this B12 paper. I wrote it before 2007. It was published 10 years ago, 2007. It's a great book. It's being published in other countries, and I think you're going to very, very much enjoy it. We've gone through a lot of the intestinal tract, and we're kind of down towards the large intestine. Where I left off last week is a point that you really need to understand, and that is that the foods that we eat cause the health or disease of the intestine. You go to a doctor often, and when I say often, I say awful a lot of times, but not all the time, and you ask him if diet has anything to do with your health or your constipation or your indigestion or your rheumatoid arthritis. And doctors, at least I was taught that way, and I hear the same general message. They'll say diet has nothing to do with health. How could that possibly be? Or diet has nothing to do with your intestinal tract. Where would you look first if you had intestinal problems? You'd look at the substances that touch the intestine. It's just like if you had skin problems. You'd look for things that are affecting the skin, lotions or some kind of toxins that are getting on your skin. If you had lung problems, like cough, you'd look for things that go into your lungs, like tobacco or food or airborne allergens. Well, when you talk about intestinal problems, why wouldn't it be the first thing that a doctor or you would consider is what you put in your intestines? The problem with people's intestinal health, and the intestines are the portal of entry of the nutrients, and the rest of your health reflects what goes on in the intestines. The problem is that we put the wrong kind of food in our intestinal tract. And when you change your diet, immediately the intestinal tract changes. Well, almost all the people who come to our clinic who are on various kinds of antacids, proton pump inhibitors, Prilosec, Pravicid, Nexium, etc., almost all of them get off these pills within 2 days, 1 day. Almost everybody solves their constipation problems in just a couple of days. And also the diarrhea problems, which we're going to talk about next time I'm on. We're going to talk about diarrhea issues related to diet. But the constipation goes away. And as I've joked, and I've probably joked with you on the webinar, is where we run our resort, one of the things they notice they have to do is they have to order more toilet paper and during a McDougall 10-day program. Because the bowels, they work really great just within a matter of just a few days. It's everything about the food on the American diet that makes the intestine and the rest of the body sick. To identify certain things in the food is a bit artificial, but we commonly do that. We talk about the fiber in the food, or the oil in the food, or the cholesterol. It's actually the whole food. I don't mean in whole and healthy. I mean the whole food in terms of components that affect the intestine in a positive or negative way. When you eat the Western diet, you eat a diet that's high fat, high in animal protein, and also low in dietary fiber and low in starch, carbohydrates. Dietary fiber, as we ended last week's discussion, is just sugar that is put together, glucoses that are put together in long chains with non-digestible linkages between the glucoses. And so the sugars, the long sugars, which are called dietary fiber or indigestible carbohydrate, these long sugars stay intact while passing through your intestines, and they go all the way to your large intestine. When sugars are made of glucose, again, glucose, and put in long chains with digestible linkages between the sugars, then that's called carbohydrate. That's called starch. So that's the only difference between starch, chains of carbohydrate, and dietary fiber, chains of carbohydrate, is that the linkages between the sugars in one case are digestible and provide energy. In another case, they do not break down and they provide bulk for the intestinal tract. And it's more than just bulk in terms of whether or not you're constipated. It has this fiber has to do with how quickly nutrients are absorbed into the rest of the body. They control your cholesterol level. They detoxify poisons that you take in. They complex cholesterol in your body and help remove it through the gastrointestinal tract with your bowel movements. So fiber provides a lot of important actions, metabolic functions in the body, not just providing bulk for your stool. Of course, you can buy Metamucil and products like that, which are bulk for the stool, and that's basically it. I mean, they have some pharmacologic activities, but you really want to get the fiber from the food. So where we ended last week was with this picture, if we can put it up, and that is that when you eat the American diet, because it has so little fiber, there's no fiber in any animal products, and bread and rice is often refined, and so the fiber is taken out. If you can look at the frame, I think it would be up on your left-hand side. What you see is, there you go. What you see is the large intestine. At the very, at the very lowest part is the cecum with the appendix, and you see the small intestine going into that area. If you eat the American diet, everything gets digested, gets absorbed in the small intestine, and there's very little left to go into the large intestine. So you have these small remnants of food that go into the large intestine, and they have to be moved from the cecum up the ascending colon, along the transverse colon, and down the descending colon, and out through the rectum. And if their fiber is all absorbed, then what happens is there's really no mass in the large intestine, and so it has to contract at small diameters. And what happens is when you contract at small diameters, according to the law of Laplace, it creates high pressures that blow out these balloons we talked about last week called diverticuli. And as you notice there, in fact, you can show the next slide, as you notice they're associated with blood vessels. You see the diverticuli, these are outpouches or balloons that are caused by high pressures in the large intestine. They break out right next to blood vessels because that's the weakest part of the intestinal wall, where the blood vessel dives in through the wall. And so one of the most common signs of diverticular disease is bleeding. And what also happens is the opening of these pouches gets inflamed, and these pouches become inflamed and infected, and you develop diverticulitis. Now, that's where we left off last week. Now, what happens after you move this small content of material through the entire colon? What you have to do is then you have to have it see fresh air. And as you move this content through the colon, water is taken out of it, and you end up with this hard rock, tiny fecal mass. And now you have to get this mass to leave the intestinal tract. And so next slide, Gustavo. I love this one. This is Larry sitting on the toilet, grunting and groaning and straining to get this rock hard marble to pass maybe every day, but sometimes every 3 to 12 days. And to get it to pass, you have to put a lot of straining into it. You have to kind of grunt and groan and put pressure on your abdomen by holding your breath and straining. And that straining causes damage in the body. In addition to it being very painful and taking a long time to do, what happens is that all that straining, you see Larry sitting there with the red face. That's blood being pushed up into his face by all the straining that he's having to do, all the work he's having to do to get the evacuation of this rock hard fecal marble. That straining not only pushes blood into Larry's face, but also into the rest of his body. And next slide, Gustavo. When you push blood into the veins of the body, what happens is you cause destruction. Now, what we're looking here on the right-hand side, where you see this is the rectum and the anus. And those veins that you see there, that darker red shaded, that's a hemorrhoid. Hemorrhoids are veins that are in the last part of the large intestine. They're in the anus and rectal area. And what these veins are there for is to provide a cushion, a better closure, so that gas is not so easily and inappropriately released. These veins contain that. And likewise, stool is not inappropriately released because of this cushion of these veins around the anus and in the lower part of the rectum. Well, when you grunt and groan and strain, you dilate these veins. And after years of dilating, stretching these veins, they hang out your butt. And that's what's called hemorrhoids, are just these veins hanging out your intestine, your lower part of your intestine. Now, some of them are called internal hemorrhoids, which are ones that form in the lower part of the rectum, and some are called external hemorrhoids, and those are the ones that are even further down, more in the anus area. But they end up stretching out and hanging out your butt. And in addition to being unattractive, and you probably don't have a high level of study in this particular area, but hemorrhoids are not attractive. They're also painful. When you defecate, they cause pain, and they bleed easily. And sometimes between the hemorrhoids, you get infections and you develop fissures. So you have this itching and pain and bleeding and fissures that form and so on because of these stretched out veins. Well, if you change your diet, the veins do not become unstretched, but the symptoms go away. I mean, I've seen fissures heal. I essentially always see the bleeding and the itching stop when you change your diet. But the hemorrhoids stay there. The only way to get rid of the hemorrhoids would be to have them surgically removed, which can be done, but I don't recommend it unless it's somehow really troubling for you. This is, can be a relatively, simple procedure, but it can be painful too. They will treat it by surgically removing the hemorrhoids or banding them with rubber band-like apparatuses that go around the hemorrhoids and essentially cause the vein to die and fall off. So there are ways to treat them, but I suggest you don't. You just eat a good diet, you prevent new ones from forming, you get rid of the symptoms. So that's one consequence of Larry grunting and groaning and straining, is to push the veins out of the last part of the large intestine and cause hemorrhoids. Next slide, please. With that grunting, groaning, and straining, you also push blood into the veins of the legs. You can see this, you can see Louise standing there. You can see her venous system. And of course, you can see her sitting on the toilet, grunting, groaning, straining too. Well, the venous system that you see on Louise in her standing figure, this represents veins that go from the toes all the way up to the heart to return the blood that the body has distributed to the various tissues. So you have the arteries pushing blood out through the body, and then of course this arterial blood nourishes the tissues, and then after the oxygen leaves and the carbon dioxide picks up and toxins are picked up, that blood is transferred back to the heart through and then further circulated by a venous system. Well, these veins, you see them going from Louise's toes all the way up to her heart. That column of blood is about 4 to 5 feet. 4 to 5 feet column of blood. And that much blood at that height creates tremendous pressures. Just because of gravity, having 4 or 5 feet of blood creates tremendous pressures. And one of the ways the body deals with this pressure is it has veins. And you can see those veins in the center tubular structure. You can see those veins. So as the blood flows back up towards the heart, it doesn't fall down because the veins stop the blood from falling down. Now, the way you get the blood, by the way, the way you get the blood to flow back to the heart is by general contraction of your muscles. When you walk along, what happens is your leg muscles contract and they push the blood back up towards the heart. And then again, to prevent it from falling down, you have veins that prevent it from falling down back to the feet. And in this stepwise manner, you return the blood to the heart. When you grunt and groan and strain, what you do is you dilate these veins because you put tremendous pressure on them, and you also dilate and stretch out the valves. And the valves become incompetent. And so now you have this long column of blood, this high pressure of blood in your whole venous system and in your legs and so on. And as a result of this high pressure and the incompetent valves that are supposed to reduce the pressure, you get dilated veins in your legs. And these are identified as blue worms by some people. And of course, they're called varicose veins. Again, once you cause this damage and you stretch these veins out, you can't cause them to go back no matter what you do. They're permanently stretched out, and you really don't want to do anything about them in most cases, unless, of course, you feel like you have to. Sometimes for cosmetic reasons, you might want to have them treated with lasers or sclerosing agents, and those are small veins. But big vein, the treatment of big veins is a really major thing. I can remember, and again, I'll remind you that I put myself through medical school as a surgical nurse, but I can remember where we treated people with these large vessel varicose veins by making a little slice in their ankle and finding a vein and sticking a long catheter up that vein and then pulling the whole vein out of the leg. And you had this, like this 4-foot worm when you got done. And of course, now you don't have good venous circulation. You've taken away what you do have, and other veins become dilated. I mean, really, this is a last-ditch effort, but it used to be common treatment. I don't know exactly what they're doing these days for people with large vein dilation or varicose veins. Remember, there's superficial we talked about, and then there's the deep veins, the large ones. So, I just leave it alone. I eat good so you don't cause those pressures to be high again, and you don't make the venous system worse in the legs. And the other thing, if you look at the valves there, you see the darker material is a blood clot. Blood clots in the veins, particularly in the legs, are notorious for causing trouble. They cause deep vein thrombosis or blood clots in the legs, and they can become swollen and painful. But the other real hazard is these blood clots that are in the legs that form as a consequence of inadequate circulation and a bad diet. When you eat an unhealthy diet, it causes the blood to want to clot. Animal fat causes the blood to want to clot and the platelets to want to aggregate. So you set yourself up for clot formation, and some of these clots break loose and they go to the lungs and they'll kill you with pulmonary embolus. From my lecture last week and other discussions I've had, and if you go to my January 2013 newsletter, you can listen to Dennis Burkett talk about his experience in Uganda, Africa, where he saw no varicose veins. He saw no deep vein thrombosis. He saw no pulmonary embolus. Remember, he was the head of the Ministries of Health of Uganda for 17 years, oversaw 1,000 hospitals, oversaw 10 million people, and never saw this condition. This is a disease of the Western diet. So eating a good diet also will decrease your risk of blood clot formation and pulmonary embolus. All right, so that's another consequence of strain. Let's go on to the next slide. When you grunt and groan and strain, this is a woman, this is Louise, and what we're looking at is we're looking at a side section of her sitting on the toilet, and you're looking at her uterus, which is the darker red structure there. And the lighter pink structure is where the uterus used to reside. That's where it used to be positioned. As when she was a younger woman, it was held up there in the pelvic cavity by ligaments. But through years of grunting and groaning and straining and putting pressure on the uterus, what happens is you stretch out the ligaments, and now the uterus falls down into the vagina, and you get a prolapsed uterus. And in many women, the uterus ends up hanging out of the vagina, actually. And again, this is permanent stretching. It's permanent destruction of the ligaments. And eating a good diet is not going to make the uterus go back into position. Sometimes it helps when you eat a good diet and you lose weight. That helps the prolapsed uterus. But otherwise, you shouldn't expect it to get better just with a good diet. There are ways to treat it. One of the most common ways is to take and remove the uterus, do a hysterectomy. But there are also instruments. They're called pessaries, which can be used, inserted in the vagina to hold the uterus up to help with some of the problems. But in general, women who have a prolapsed uterus should just basically live with it unless they can't. And then they'll have to maybe try something like a pessary. Or, a last-ditch effort would be to have surgical repair of the uterus. The doctors can do things like cystocele and rectocele repair, which they go in and, try and restructure some of the tissues and get the uterus to lie higher up into the pelvic cavity. You can have these done, but again, I would encourage you to make that a last-ditch effort. Now, to avoid being gender biased, in men, as far as their genitals go, when you grunt and groan and strain, you put a lot of pressure on the veins in the scrotum, and these veins in the scrotum dilate, and you have varicose veins in the scrotum. That's how men are affected in their genital area by this grunting and groaning and straining, is the dilation of veins, which can be, a cosmetic issue. It can be of some pain for a man, and surgeons can treat it, but you really don't want to do that unless you have to. So there's another consequence of grunting and groaning and straining to move this rock-hard fecal marble. This is all due to pressures. These things are not mysteries, and we've known about the cause and also the prevention for 40 or 50 years. To get back to one of our underlying journal discussions is, well, why isn't this taught to people? And it's just basic business. We emphasize to people messages that cause great profits for companies and for individuals. And so as a result, because money drives the message, you don't hear about the dietary connection to varicose veins, hemorrhoids, prolapsed uterus, and the next problem we're going to talk about. But let's look at the next slide. Remember, you're grunting and groaning and straining. And what happens, and this follows up on our discussion from a few weeks ago, what happens is you end up pushing the stomach up into the chest. So you look at the left-hand frame and you see the stomach lying in its normal position. It's being supported on either side of that narrow spot by the diaphragm. That narrow spot, the esophagus is above and the stomach is below. That narrow spot is called the lower esophageal sphincter. When that becomes incompetent, then you had developed GERD, which we talked about before, gastroesophageal reflux disease. It becomes incompetent and acid refluxes up into your esophagus, causes all kinds of problems, including asthma and sinus problems and hoarseness and cough and so on. The reason that this stomach becomes malpositioned, becomes pushed up into the chest, you see that, remember there's a diaphragm there on the left-hand side, that's the normal position of the stomach in the abdomen. The reason it gets pushed up through the diaphragm is because of grunting, groaning, and straining. And you develop something called a hernia. A hernia is a dilated muscle. It could be in your abdomen, and we call that an inguinal hernia. If it happens to be here in the stomach, we call it a hiatal or hiatus hernia. And you can see, if you look at the right-hand frame, the improper position of the stomach. Here it has been driven up into the chest, and you see the lower esophageal sphincter, which is the narrow part, is up above where it should be, above the diaphragm, which was giving it support. And now it is incompetent, and you develop GERD. Again, this is a mechanical problem. It's not going to be fixed by changing your diet, but the symptoms of GERD are almost always improved or completely gone when you eat a healthy diet, because a healthy diet is so powerful. If you want to have this repaired, there are surgeons who will go in and they'll pull your stomach back down into its proper position in the abdomen, and they'll tighten the hole, the hernia, the hiatus hernia. They'll tighten it with surgical procedures, and the stomach will lie where it should be in the abdomen. But again, that's a very last-ditch effort. You don't want to do that unless you can't live with your symptoms. And most of the time, as I've said, the symptoms go away when you change your diet. The hemorrhoids stop bleeding, the indigestion goes away, the GERD stops. And so, try first to fix your diet. And then the next step would be judicious use of medications. And then the last step would be, talk to surgeons. They can rearrange mechanical damage, often with a lot of side effects, risks, and costs. So you don't want to do that unless you have to. Well, that is, I think, the last one I want to talk about today, as far as the gastrointestinal tract goes. We'll talk about irritable bowel syndrome, maybe about celiac disease, and other things in the next presentation I give in a couple of weeks after Dr. Doug Lyle. So, does that all sound pretty clear to you, Gustavo, on what's going on? It makes sense. What you put in your bowel causes it to have health or disease. It is so obvious, but doctors have been treating people with intestinal problems when, again, I have to refer back to my earlier experiences. You may get tired of this, of me talking about back in the old days when I had to walk to school in the snow uphill both ways. I just have to tell you about the experiences that I've had in terms of this, these diseases and what to do to fix them. And I've tried to make it clear for you. And certainly the Digestive Tune-Up book is a worthwhile investment. Again, you can probably buy it for 50 cents in a used bookstore, but they sell it at Whole Foods and Amazon, and all local bookstores can order it for you. It's a big selling book. I think I mentioned it was going to be published in Czechoslovakia last week. I think that's where it was.
Yeah, you mentioned it.
But it's a phenomenal, worthwhile read. And many people say they never thought they could sit down and read a book about the intestines from cover to cover and enjoy it. But many people have told me they did. And it took a lot of imagination and effort and help to make it enjoyable and to not make it not only boring, but not understandable. The book does what you really want to do in terms of understanding intestinal problems, but it all comes back to eating a good diet. All right, Gustavo, do we have any questions today?
We do have a lot of questions, so we'll see how many you can take. One question is, once switching to a starch-based diet, does it take a while for the bowel issues to straighten out?
Good question. How fast does it take? I would say for most people, within 24 hours, they're noticing improvements. 24 hours. Certainly within 3 days, you should have tremendous improvement. I tell people when I see them the first day of the clinic, say I see them on Friday, Saturday, Sunday, I tell them, look, if this constipation isn't gone completely in 3 days, we need to talk about it. And then what I'll do is I'll do some couple extra things for people if the constipation isn't gone. We'll talk about diarrhea next time. But what I do is I will feed them prune juice. Prune juice is the only juice we serve at our program. Or prunes, or I'll feed them Uncle Sam's cereal, which is a flaxseed and wheat fiber-based cereal. That helps. Sometimes when we first start the program, when it comes to constipation, I have to even be more forceful, and I'll put people on a little milk of magnesia to get things going, to get started. And the last effort that I take would be to put them on a non-absorbable sugar that's by prescription called lactulose. And you'll find all of that in, let's see, I think that is in my September 2002 newsletter titled In Search of a Perfect Bowel Movement. How about that for a title? In Search of a Perfect Bowel Movement. And he gives you all kinds of solutions, extra things you can do in terms of fiber. And that's my September 2000 newsletter. Free, easy to find, no gimmicks, no pop-up ads at drmcdougal.com.
Dr. McDougall, since you were mentioning...
As far as the upper intestinal problems go, again, same timetable. It's usually a day that people get complete relief of their indigestion and their GERD. And if it hasn't happened by the third day, I talk to them about it. We usually stop all of the proton pump inhibitors, like Prilosec, Prevacid, Nexium, so on, the first day that they come in, if they're willing. And most people are excited about doing that. And if they have indigestion after stopping the proton pump inhibitors, then what I do is I tell them that they should maybe try some wafer antacids or liquid antacids, such as Tums, different types of simple oral preparations to help with the occasional indigestion. And then I'll also prescribe H2 blockers, such as Zantac, to be used as needed. And on rare occasions, I can't get people to stop taking the proton pump inhibitors, but it's rare. And the other things that I do for people who have indigestion is I raise the head of their bed, as we talked about, so gravity pulls the acid out of the esophagus, and that's often very helpful. And one other thing that I have to repeat or emphasize again is there are foods on the McDougall diet that cause indigestion. And these are particularly raw vegetables, and especially onions. I personally cannot eat raw onions. Now, once you cook them, then you distill some gases that cause the indigestion off of them. And so cooked onions are well tolerated. So if you come to our 10-day program or even the weekend, we'll serve you burgers with cooked onions. And that's why. So you have to be careful about raw vegetables, particularly onions, cucumbers, green peppers, and radishes. And the other thing that's very troublesome to people when it comes to indigestion is fruit juice. Remember I said the only juice we serve at the program is prune juice to help stimulate the bowels. But just thinking about grapefruit juice or orange juice, just thinking about it. There are many of you out there that get indigestion just thinking about it. And somehow these juices cause terrible indigestion. And it could be any juice, not just grapefruit, orange juice that I just mentioned. They cause terrible indigestion, but the fruit itself, the grapefruit or the orange itself, will not give you any trouble. It's just after you pulverize it and then remove some of the pulp that somehow or another it changes the properties of whatever was in the fruit to cause people to have horrible indigestion. If you don't have that reaction, I think drinking some fruit juice is okay. It's not a big deal for most people. It is a lot of simple calories, a lot of simple sugar. So it's not a part of our diet in terms of what we recommend in general. But hey, the body's tough. It lived on hot dogs and hamburgers and bacon and pepperoni pizzas. It survived. You get by on a little juice here and there, but don't think that juice is an improvement in the food. You don't improve the food by beating it 1,000 times with the steel blade. And I'd rather have you eat the fruits whole and keep the fruit juices to a minimum. And if you're not doing well, think about the fruit juice and the raw vegetables in terms of indigestion problems.
And if that doesn't help, then go to one of your 10-day programs and you'll see how it works.
That's why we do that. I mean, in addition to it being our main core business, I'm not trying to, I'm a doctor. I'm a medical doctor and internist, and this has been my form of practice for 40 years to run residential programs. So it's our core business. So I would, and it's something I developed over the last 50 years. So it's the best thing we have going is the 10-day program. The intensive weekend is the least expensive, most personal experience that we have. The intensive program, like we're having starting tomorrow. Yes. And the vacations are fun. I remember Kauai.
Oh yes,
big deal.
That was fun.
And then we also do advanced study weekends, which we're not doing one this September. Instead, we're doing another intensive weekend. We may do another advanced study weekend in February of 2018. Great. Yeah, personal contact is what it's all about. I mean, everything you need to know is free on the internet, but people still go to universities and colleges to learn. They still go to internship experiences to learn. The personal contact, the interaction is, crucial in education. I could learn how to do my own taxes. And I could do it by reading a book, but I would probably go to CPA school. And if I really wanted to learn how to do them and do it that way, there's nothing like the personal interaction. And the more intimate it can be, you can be as casual as just going to the website, reading the articles, watching our videos, all for free. Or it, can increase to you reading the books and reading more of the newsletters. That's more exposure. And then spending some time with Mary and I and the team, that's a great experience too.
Yeah, I want to just reassure people that this webinar is recorded. So tonight, everybody should get a link so that they can watch it, because some people were asking. That's why I'm saying that. Okay. Well, Dr. McDougall, we do have a lot more questions, but we're going to have to do them next time.
Okay. It's been a pleasure, folks. I have to say that this is a very exciting world here in the springtime of 2017. And I know a lot of us have worries and concerns, personal family problems and worldwide issues and so on. And what I would encourage you to do is take advantage of the things that you can control. You can't control what's going on in the Middle East, or I'm not going to get political, there's some things you can't control, but the things you can control, like wear your safety belt, buy a really structurally sound car, don't smoke cigarettes, be very careful with alcohol, and eat a good diet. I mean, nobody can force you to eat the wrong food. Once you know what to eat, a starch-based diet. Remember starch, rice, corn, potatoes, beans, peas, lentils, pastas, with some fruits and vegetables. And cooked has some advantages. Remember, we talked about raw. Raw food is kind of tough on the intestinal tract. And cooking is what made people. What made humans was fire and being able to cook food. That was one of the necessary steps in terms of getting enough calories so that we could grow the brains that we have, is being able to cook the food and release more of the energy. So I'm not an advocate of an all raw food diet, but you can eat some raw food. It's okay. I certainly do. I enjoy it, particularly bananas and my tangerine tree. Let's see. I got buds. It's just right outside the window. I have, so I think I'm going to get some tangerines this year. Lately it's been a little more iffy here and there, whether the apple tree blooms or the plum trees bloom or the loquat trees bloom. And when my nectarine tree did not produce last fall, it was very upsetting to me because I love my nectarines. Anyway, it's been a pleasure talking to you today. Take advantage of the website, share the message. We have a world to save. And Gustavo and I and the rest of our short team here together, we hope to be leaders, but we need all of you to help to go out and spread the good news. And, I know once you discover it yourself and you get well, as Gustavo and I and, thousands of you out there listening have, you look at yourself and you go, why doesn't everybody get this? You may find yourself like I do, walking down the restaurant aisle, looking at people who are sick and overweight, and wanting to go up to them and grab them, and shake them, and say,
I know
the reason you're sick is right there in front of you. This is what you need to do. But I try and resist myself unless I get into a situation where somebody opens the door and then it's all over. I can't keep quiet. But it becomes, once you understand this, it becomes obvious as to why your friends and family, your community, all the people in your shopping mall are fat and sick. It's no mystery. And the solution is cost-free, side effect-free, cut your food bill by as much as 80%, or maybe 90% if you eat out a lot, is environmentally friendly, is kind to animals. It just makes no sense except for the fact that it's all about cents. Those are American coins. Anyway, my humor is getting bad. I better quit. So it's just about the money, folks. And save yourself, and let's work together and save the world.
Very good. We will see you in 2 weeks then, Dr. McDougall.
I'll see you in 2 weeks. I'll see many of you this weekend at the intensive weekend.
That's right.
I really look forward to that. And there's a lot of information on the website. And again, there's no gimmicks. It's free.
Take advantage.
It's our privilege, Gustavo's and mine and Mary's and the rest of the team, our privilege to share the good news with you. Nothing's better, nothing's more rewarding than to help other people. So thank you, Gustavo. We gotta take the hook and pull me off the stage.
Well, goodbye. We'll see you in a couple of weeks, and have a wonderful weekend. I wish I was there, and this time I couldn't make it. But
you've been in a lot of the weekends and adventure trips, and it's been just a pleasure having you as a good friend.
Thank you.
And professional associate. Okay.
Okay.
Goodbye, Gustavo. Goodbye, folks. I'll see you soon.